In their book, Human Genetics, The Basics, Ricky Lewis, adjunct professor of medical education at Albany Medical Center, states that DNA sequences are 99% alike. This means that the 1% difference in our DNA sequence is responsible for our individuality as well as the illnesses that we encounter in our lives. Alpha-1 antitrypsin deficiency is an underdiagnosed genetic disease that affects our lungs, liver, and skin. Today, I will be informing you of the cause, the symptoms, and the treatment plans available for individuals living with Alpha-1. First, I will give a brief summary of how our genes work and explain how Alpha-1 antitrypsin deficiency occurs. Next, I will talk about the symptoms that individuals with this disease experience and the parts of the body that are most affected. Finally, I will discuss the different treatment options available for those living with this autoimmune disorder. So how do our genes work? The human genome is like a set of instructions used to build the human body. 2 copies of our genome are entwined inside each of our cells. This topic can get a bit confusing, but it's important to understand how our genes work in order to understand how Alpha-1 affects our body. So stay with me for a moment. Our DNA, RNA, and protein are the informational molecules that make up our genome. A gene is the information in a sequence of DNA building blocks that is copied into a molecule of RNA and then used to build these proteins. These proteins are responsible for our traits and illnesses associated with the gene. The DNA sequence of a particular gene can vary from person to person, and most of the time, these variants are going to have little to no effect on our health. Ricky Lewis does a really great job of explaining this in their book, Human Genetics. Lewis states that most gene variants have no effect on characteristics, including health, like the meaning of a sentence being clear even if it has 1 or 2 typos. But at the same time, a more serious keen error can greatly alter the meaning of a sentence. So, in the same way, some changes in a gene's DNA sequence can harm our health. These types of variants are traditionally termed mutations. So, how does somebody get Alpha-1? Well, Alpha-1 antitrypsin deficiency is an inherited condition, meaning that it's passed from parents to their children through their genes. For each trait a person inherits, there are usually 2 genes, one from each parent. Normal genes are called M. A person who does not have Alpha-1 will have 2 M genes. So, people who have received 2 mutated Alpha-1 antitrypsin genes are going to have Alpha-1. One of these abnormal genes has come from their mother and one from their father. The parents in this situation are known as carriers. A carrier is going to have 1 M gene and 1 mutated gene. Carriers are also at risk of developing diseases related to Alpha-1. They may have lower blood levels of Alpha-1 antitrypsin protein, but their levels are not as likely to be as low as those living with Alpha-1. However, this isn't always the case. Some individuals who are carriers, like myself, are going to experience the same or even worse symptoms than those living with Alpha-1. It really depends on which mutated genes you have inherited. So now that we understand what Alpha-1 is and how it can occur, let's talk about how it can affect the body. For a person who is not living with Alpha-1, Alpha-1 antitrypsin, or AAT, is made in the liver and then travels to the lungs, coding it and controlling the activity of neutrophil elastase. Neutrophil elastase is made by white blood cells and is required to fight infections. When someone has Alpha-1, AAT protein gets trapped in the liver and it does not travel through the body into the bloodstream, and neutrophil elastase is not properly controlled. This can cause liver disease, damage, and a decrease of AAT in the blood. When this happens, AAT does not coat the lungs, and it can lead to lung tissue damage. But how does the body feel when this happens? So symptoms of Alpha-1 will vary depending on which mutated gene a person has inherited. The most common signs and symptoms related to lung problems are going to be shortness of breath, wheezing, chronic bronchitis, which is a cough and a phlegm production that lasts for a long time, recurring chest colds, less exercise tolerance, such as getting shortness of breath or chest tightness when exercising, year-round allergies, or bronchiectasis, which is a long-term condition where the airways of the lungs actually become widened. This leads to a buildup of mucus and can make the lungs a lot more vulnerable to infection. Symptoms that are associated with liver are unexplained liver disease or elevated liver enzymes. This is how I was diagnosed. I went in for some upper right quadrant pain, which is located here underneath your ribs on your right side. I was sent for an ultrasound and found that my liver was enlarged. I had elevated liver enzymes, and I had some scarring of the liver as well. Eyes and skin turning yellow is another symptom associated with the liver. This is also known as jaundice. Swelling of the abdomen or the legs, and vomiting of blood, which can be as a result of enlarged veins in the esophagus and in the stomach. And it is also rare, but some people will experience a skin condition called paniculitis. This causes hardening of the skin along with really painful lumps and patches. If you're showing signs and symptoms of alpha-1, your doctor is going to listen to your breathing and check for wheezing or other signs that your lungs are not working properly. You're going to get blood tests to confirm your diagnosis. These tests will let your doctor know which mutated genes you have inherited, and look to see how much of the AAT protein is in your bloodstream. Your doctor will also test your lungs and liver to see how much damage the condition has caused, for example, using a chest x-ray to check for emphysema. Alpha-1 can be really difficult to diagnose. Patients commonly present with respiratory symptoms that are often mistaken for COPD or asthma. It's really important to be an advocate for yourself, find the right doctor, and find the right treatment plans that are going to help you and your body. The only specific therapy for alpha-1 antitrypsin deficiency is augmentation therapy. Augmentation therapy is the use of alpha-1 antitrypsin protein from blood plasma from healthy donors, and this is going to help increase the alpha-1 levels circulating in the blood and the lungs of those diagnosed with emphysema. According to the Alpha-1 Foundation, the basic goal of augmentation therapy is to increase the levels of alpha-1 protein in the lungs so that it can protect it. It's very important not to smoke if you have alpha-1 deficiency. Smoking can speed up lung damage associated with alpha-1 antitrypsin deficiency, and you should also avoid things that are going to irritate your lungs, such as pollution, dust, or chemicals. Finally, you should also minimize alcohol consumption to protect your liver, which is also affected by alpha-1. Today I introduced to you all an underdiagnosed autoimmune disorder known as alpha-1 antitrypsin deficiency. I explained the cause, the symptoms of the disorder, and the treatment plans that are available for those who are living with alpha-1. As I stated at the beginning of my speech, our human DNA sequences are 99% alike. This means that within that 1% difference, there's over 6,000 different genetic disorders that can occur. Around 1 in 50 people are affected by one of these disorders. Look around you. Going off that statistic, be aware that someone in this room with you right now is suffering from a genetic disorder, and that might possibly be alpha-1 antitrypsin deficiency.